Hello, good morning, everyone. Kindly confirm you can hear me, please.
Yes, we can. Good morning.
Okay, perfect. Good morning, everybody. My name is Anu Oluwapo Afolabi, and I am glad to welcome you to today's webinar session titled Formulating SMART Research Questions. The webinar has been organized by Plus-CircleCommunityHealth Advancement Organization, a not-for-profit health organization committed to advancing school health, community health, and capacity building for research. We implore you to kindly follow us on all our social media platforms: LinkedIn, Facebook, Instagram, and YouTube for timely content and updates. So, in today's session, we implore listeners and participants to stay muted throughout the session. Actually, participants are muted as they join. And if we are not speaking or asking questions at any time, please kindly let's stay muted to avoid and or minimize disruption. The session promises to be very interactive and participatory. Okay. Without further ado, I would proceed to introduce the speaker shortly. Dr. Olayinka Ilesomi is our speaker for today. He's a known face who has been invited to speak on such a webinar as this in previous times. Okay. Dr. Olayinka Ilesomi is a four-time Dr. Olayinka Ilesomi is a four-time top 2% scientist globally for 4 consecutive years. That's from 2020 till 2023. And he has published over 300 public articles in high impact factor journals, both locally and globally. And he's committed to advancing research capacity building for early career scientists and for intending scientists as well, those who are yet to start but who have the intention to do so. Okay. So without further ado, I would like to hand over the microphone to Dr. Elisomi. Please, participants, as the session goes on, if you have any question, kindly take note of them or use the chat box to post in your questions from time to time. I will promise that the speaker will attend to the questions together after the entire session. Alternatively, if you would like to use the hand raise icon after the presentation to ask your questions, please do so. We implore you to call a friend, to invite another friend for this amazing session. All right, without further ado, I invite Dr. Elisomi. Please let's put our hands together as we welcome him. Thank you. Over.
Okay, thank you very much. I want to be sure that my voice is audible. Can you hear me,
Yes, your
please?
voice is audible. Kindly, your face is not showing too well. Yeah, it's better. Yes, it's better. Thank
Okay,
you.
thank you so much. So thank you very much, Ms. Anodua Pafolabi. So today we are talking about formulating SMART research questions. And if you look to the left panel of my slide, you see like form of mathematical equation. We are not calculating, but we are formulating. We are looking at how do we get this done at a very best, the best way to get it done. How do we need to formulate SMART research questions? And I think I won't I will be sure to maximize the time because we have a few things to cover today. So I'll just talk briefly about what research is, and I believe that we are all familiar with that. But before I go ahead, I would like to appreciate as many people that have joined already, and I would like to also appreciate a few colleagues that I've seen on the webinar, and I want to also appreciate those who have been joining consistently. Now, we'll talk briefly also about how to choose a research topic, and now we go to the meat of the day, which is formulating SMART research questions. We are going to look at the characteristics of SMART research questions and some basic examples. And then after that, we should be able to lay our hands on how to formulate ours. Now, what is research, if I may ask? A systematic process of inquiry aimed at discovering, interpreting, or revising knowledge about a particular subject. So I believe we are familiar with this definition, research has to be about a particular subject. That is something you want to research. That is something you want to make inquiry about. That is something that you aimed at discovering. Or maybe there is something you need to interpret, and or there is a knowledge about a particular subject that you want to revise or you want to add to, and so on. And we are familiar that research involves collecting data. And after collecting the data, you want to analyze it. And you also need to draw conclusion. But before you draw your conclusion, you need to answer a particular question. A particular problem must have been solved, or some ideas must have been explored during the conduct of your research. Think about the researches you've done in the past. You must be answering a particular question, or there must be a problem that you are solving, or a new idea that you are trying to explore. Now, the goal of research, generally speaking, is to advance our understanding in a specific field. Mind you, I've always emphasized particular subjects, specific area, specific field, or you want to contribute to practical solutions to real world issues. Probably people are wondering, how is mpox spread? Probably that is not all known yet. And you want to solve that problem, you want to contribute, then you go into research. Now, before you select a research topic, you must look at the feasibility of the study. Is the study interesting to you? Is it novel? Is it ethically acceptable, or is it relevant? Some things are probably not relevant, even though they are feasible, they may be interesting, but they are not novel. There's nothing new about them. People have researched over and over about that particular topic. Now, it must also be ethically acceptable, no matter how those other criteria are selected and they are fitting. But if it is not ethically acceptable, nobody will allow you to go ahead with the research. And people have gone into trouble in the past because they have carried out things that are not ethically acceptable. But today's discussion is not focused on research ethics. Now, when we talk about developing a research idea, there must be a question that exists in your area of specialty. So I must look at my area of specialty. What are the questions that are yet to be answered? What are the questions that needs to be answered? Are these questions interesting? Are they of interest to anybody? Who are the people that the questions are of interest to? Now, what are the opportunities that are available? And what are the common things that has to be done? What are the available resources and expertise? And before you move ahead, you must be able to understand if there are available resources and expertise. Are funding available? Do you have the time to carry out the study? All these are very important, and they are questions that has to be answered. Now, apart from this, when you want to select a research topic, you must also look at the relevance of the topic to your day-to-day work. What is the relevance of the topic to your environment? If you're a clinician or you work in the hospital, what is the relevance to your patients, to the co-workers, even to the community where you belong to? The relevance is very important. And you must also give priority, because you don't have all the time in the world to conduct a single research. So you must give priority to maybe diseases that have high prevalence, conditions that have some high morbidity or mortality. Generally speaking, I'm talking about things that are of interest to the people, things that will contribute some information to what is already existing. What are the needs of the patients? What are the needs of the community? For instance, at the moment, there is no known drug for the treatment of mpox. You may want to look at a particular drug. If we use it for patients that have developed mpox, does it help them? What's the needs of the patients? How do we reduce anxiety? How do we reduce the dermatitis in patients that have mpox, and so on? So the needs of the patients, the needs of your co-workers, and the needs of the community must actually be given high priority. Now, what are the other steps involved in selecting research topic? I'm aware that today we are not discussing research topics, but this is very important for us to be able to build on it. So we should be well. Any problem that you want to solve, if the problem is well known, as it is said in Africa, it is half solved. So once your problem is not well known, then it is difficult for you to solve that problem. So there is a need for you to understand the problem that you want to solve very well. You may need to brainstorm topic ideas. When you are brainstorming, you can share with others. You can discuss with colleagues or contemporary, oh, this is what I'm thinking of. Evaluate each possible topic for the appropriateness. Is it topic appropriate? Is it relevant? Most times when some of my students want to write proposal, they are always eager to say that, oh, I've completed my chapter 1, I've written my chapter 2, I'm in chapter 3. Well, I always tell my students and colleagues that it's better you write a concept note to start with. Maybe just a page, half of a page, whatever you are thinking, put it down in black and white, type it, share with someone. Before you go on, if you have made a mistake after writing half of a page or 2 pages, it's easier for you to go back and start all over. Unlike when you have written chapter 1, 2, 3, you have spent like a month, you have written almost 20, 40, 30 pages and so on. So evaluate each possible topic for appropriateness. What I'm trying to work on, is it appropriate? And aside this, there is a need to evaluate each appropriate topic for ease and quality. You need to look at the quality. What I'm trying to work on, is it easy? Is it feasible? Can I get it done easily? I remember sometimes back, a colleague of mine had a novel idea. He wanted to do a study among hunters in Liberia, in Sierra Leone, and in Nigeria. That was shortly after the peak of the Ebola virus disease in 2015. I now asked that, how feasible was the ease of doing this? Are you going to travel to these 3 countries, ethical approval, getting your sample collected? How do you transport the sample? That all this, the more he shared with me, the more I saw some loopholes and reasons why the study, not that it's not doable, but it may not be completed at a particular time frame. So you should pick the topic on your list that you find most interesting. And also, apart from being most interesting to you, it must also be important. Now, your topic or the topic of your research doesn't have to be too broad, and you don't need to narrow it down. So knowing how to get it done appropriately is very important. And it must be interesting and important to you, or else once you start writing and you get bored, that means others may not also be interested in what you are writing. Try to be creative in selecting your research topic all the time. You can choose the same topic and even recoin it, recreate it in a way that will make it very interesting. To round up on this part of the presentation, we need to look at, after conceiving a research idea, what do you do? There is a need to discuss with a senior. When I mention a senior, it doesn't mean that person is older. I mean somebody that knows more than you do. I've had to discuss my research ideas, even with my students in the past, with colleagues. When I was in senior registrar, I had 2 very lovely and fantastic junior residents. I called them, oh, this is what I'm thinking of. So it's better you think with, or you share your ideas with people on time before you waste a lot of time. And after doing that, do a brief literature search. When I mention brief, it doesn't mean you should do it, continue writing 3, 4, 5. Just put it online and search what people have done about this. If it's something that people have answered the question you have in mind, then there is no need of moving on with the research. Develop a brief concept note. I mentioned this earlier, that if you develop a pager or 2 or 3, it's better than writing a proposal for like a month or 2 and you have developed almost 40, 50 pages of proposal. But if you can write a brief concept note and share again with someone, you can remember, I mentioned you start discussing with someone, discuss again with someone, get a supervisor. Now, mentioning a supervisor doesn't mean a professor or somebody who has been doing research for the last 50 years, 20, 30, 40. No, it may be somebody who knows about the topic more than you do. I would like to give an example. A few days ago, a friend of mine wanted to do a particular study on Lassa fever, and I've worked in that particular area for several years. So I now told her that, oh, this topic you are thinking of working on is not a topic that is feasible. Well, just to paraphrase, she was thinking of doing a study among children with Lassa fever. And I told her that the sample size that you have, even throughout the country, may not be enough to be able to justify or to be able to estimate what you are thinking of. So we now try to look at another possible way of doing that. We were considering, could it be the case control study, or would you like to do like a qualitative study among the parents of children that are positive for Lassa, and so on. So by the time you do more public literature search, again, seek expert opinion. So there is a need for you to have someone like a mentor who is always by your side when you want to carry out your research. Now, I'm not going to go through this slide again. We've talked about what research is. So we are going to move to the next. Now, it's a systematic process, and you need to establish facts. You want to gain new knowledge, and you want to contribute to a field. So when you want to pursue new understanding, it has to be done carefully. You must do it through careful inquiry and also exploration. Now, we are going to move to research questions because of our time. For you to carry out a research, you must have a question that you want to answer. You must have a question that you are considering. So consider together. The curiosity is the source of our knowledge. Now, most times when you want to know about something, you want to ask questions. Probably you saw something happening online. People will see a particular video. Somebody will put in the comment section, what is happening here? Now, that is a question. So anytime you have something in mind that you want to study or anything you want to make inquiry on, it starts with questions. So that's why we are talking today about how to formatting a smart research question. So research is the means by which we find an answer to a particular question. Now, if you don't have any question, there is no research to start with. If you don't have a question that has not been answered, there is no research. For instance, if I notice that most of the patients coming to my clinic that have given maybe a particular type of antihypertensive, they keep on coming back with elevated blood pressure. And then I may ask myself the question, why is it that the BP of my patients are not controlled? So research starts with questions. And in academic work, we formulate clear questions to guide us in our search for answers. If you ask a question in a way that is not clear, then you are going to get a wrong answer. You may get answer that is not really relevant, or maybe answer that is not even worth it. Now, what is a research question? Something you want to know about. Something you want to know about your discipline or a particular specific area within your discipline. Now, I started by telling us that research has to be specific. It must be about a particular thing. There must be something in your mind a question that you want to make inquiry about, that you want to solve. Now, it is not a topic. It is not just a phrase or just a sentence. So, but it is just something that ends with a question mark. You ask a question and it just need an answer. And mind you, this has to be clear and precisely stated. As I mentioned earlier on, if you ask questions in a way that is not worthwhile, you get the answer that you want. As it is said in computer parlance, garbage in, garbage out. So you ask question that is not clear enough, then the answer may not also be fitting. So don't make your research questions to be too broad. We are going to consider a few examples, and don't make it too narrow. When it is too narrow, then maybe nothing much to answer. And if you make it open-ended, it is better. If it is open-ended, it gives more room to inquiry. It gives more room to questioning. It gives more room to people also asking more questions. It cannot be answered in a sentence or phrase. So most times when you want to craft your research questions, it's not something that the answer will just be yes or no. Most times, if it is yes or no, then you don't really have much to make inquiry on. Now, when you want to do research, I've talked briefly about research, having your topic, and then research questions gradually. There must be a problem, as I said earlier on, that you are interested in. For instance, why are the patients spending too much time in the clinic? Or why is our clinic overwhelmed? People trooping in, they are just there because they want to see, maybe they want to see a particular doctor, maybe because you have some equipment. So it starts with a particular problem, a particular interest. Then it is followed by your research question. Until you have a research questions, you can't decide on the data and the methods. You can't decide on how to do your analysis. Until you do your analysis, you can't be thinking about your results, your finding. You can't be thinking about the implication of your work if you have not had the results. And you cannot be thinking of, let me adjust my practices until you have been able to answer a particular question about your practice. You observe and you reflect. After you have done all this, you may have more questions or problems to be solved or to be resolved. Then you go back to research question. So research question is very key when it comes to research. Now, where do we start from? If you want to conduct research and you don't really have a question in mind, you need to list your interests as they pertain to your specific discipline. Now, let's assume that my interest is on health economics. I'm thinking of how do we reduce cost of care? How do we ensure that patients don't have maybe catastrophic health expenditure? Because they are coming to the hospital to receive care, how do I make sure that they don't they don't deny themselves of their meal because they have come to the hospital? Probably that is my area of interest. Then I need to list the area of interest according to my area or interest or discipline or the assignment that has been given. Now, the questions I need to answer. I notice that patients are spending too much to receive care in the hospital. Now, I may need to answer the following question. Who are these patients that I'm thinking of? What is it about them that I need to know? Expenditure about their healthcare. When? Okay, in the last 2 years, maybe in the last 6 months, or in the last 1 month, and so on. Where? I must be able to say that I can't say I want to solve this problem all over the world. I can't say I want to know why patients are spending a lot on healthcare in all the continents of the world. It may be undoable. So my where may be in the Federal Capital Territory, Abuja, Nigeria, or in West Africa, or in Ghana. I must have a particular entity in terms of where. Why do I want to carry out the study? Why do I need to answer that question? How do I want to answer it? Then another very important thing is, so what? If I need to answer this question, and so what do I want to contribute to knowledge? For instance, if I notice that my students, the male students are taller than the female students, and I want to carry out a study, and why are male students taller than female students? My student may not be a representative of the community where they came from. Maybe they may not represent my country. They may not represent where I work. Then somebody will ask me, and so what? After you have found out why the male students are taller, what do you want to add? And I may say, okay, maybe I want to give an hypothesis that probably, or I want to give a recommendation that the short term, maybe the female student should be allowed to sit in the front, and so on. Somebody will say, and so what? So now, if at the end of the day, you are thinking about a particular question, and the answer what is coming to mind, maybe your question is even not worth exploring, and so on. Now, this represents possible gaps. Your question or your research question represent possible gaps in your knowledge. And some of these points, the who, the what, the when, the where, the and how, they are very important. And the how, the why, so what if, they are they are more difficult to answer than the who, the what, and the when. Because they are open-ended, they often lead to good research questions. As I mentioned earlier, open-ended questions are usually better rather than a yes-no thing. Now, continue until you have found an open-ended question that you would like to answer when it comes to setting or formatting your research questions. And one thing is important. Oftentimes, we don't know what we are curious about until you read about subjects. For you to be a good researcher, you must be a good reader. You must read other people's work. You remember, when we publish our work, a single manuscript may have up to like 15, 20, 25, 30 references. That means before you write that particular paper, you have read 30 other articles written by other authors. So you need to read to be able to ask good questions. By the time you read, maybe your questions are already answered. Then you don't need to ask any question again. If you read and you notice that, oh, it's because I've not read enough. That's probably why I thought this was a question. Maybe I want to know maybe my question is, where are cases of mpox higher, or where are they more? Which of the country do we have more mpox cases in Africa at the moment? And I want to do the research. I've been telling people that, oh, I need to find out which country is having more cases. And until I just go online and I found out that we have more cases in some part of in some part of Central Africa, even more than some other parts, in maybe DRC and Congo and so on. So you don't know what we are curious about until we read. Reading is very important. Don't start writing until you read. If you want to develop interest in writing, ensure you read the work of others. There was a time I was interested in health economics, and I started reading. I read almost all the publication of a renowned health economics in Nigeria. I kept reading. There was a time he had his what do they call this now? The presentation that professors do at the maybe when they are advancing in their career. So by the time he presented in his institution, I bought a copy of the book that he presented. I read it over and over again. Why? Because I wanted to become an ex economics. I wanted to know more about area to study. And I did a research, good research on earth economics. And the research at the end of the day made me or gave me an award because I read almost all the public health work that has been done. And luckily for me, this same person that I admired as a mentor, who has published more than any other person in Nigeria on health economics, happened to be my examiner. Now, assuming that I never read his work and I just went, and during the exam, he was able to tell me that he has done this, he has done that, but he has not compared this cutoff. I compare different cutoff of catastrophic health expenditure in a particular community. So he said he has not compared the three to know which one is more sensitive. If not that I read almost all his works that I could lay my hands on, I wouldn't have known where the gaps exist. So you need to read for you to develop or to discover where the gap is and what to study more. Now, go to the library and also search online academic and professional sites that are related to your discipline and to your topic. You need to read before you can formulate good research questions. Now, you can start arranging based on your thoughts. Consider the rhetorical modes which we all use to organize our ideas. When you want to speak, most times, you want to have your speaker notes, you want to put down some jottings and so on. Try to compare and contrast. You know, in epidemiology, we usually say that when there is no comparison, there is no conclusion. Before you can say that some group of people have a particular disease, the prevalence is higher, you must compare to some people before you can use the word higher. Higher means at least you are comparing two things. Highest means at least you are comparing three things. So comparison is very important. Look at it, okay, in another setting, in another population. Look at the processes, how things are developed, how things are being done, and so on. Now, classify or do classification or division. Okay, let me look at it among this group. Let me look at it. You can look at cause and effects. People that attend all their lectures, how do they perform in exams? Problem and solution. What are the solutions to this particular problem? And over again, you can consider the why, the how, the so what, and what if. If you consider all these, definitely you'll be able to come out with good research questions. I know we may have some questions going through our mind. You can put your questions in the chat box, or you should be ready to ask at the end of the session. Now, your questions can go in several directions. We are going to look at examples, as I said. Now, question to a statement of something testable. You may want to look at absence of, this is a statement, absence of regular exercise leads to an increase in weight during elementary school. Now, this is a statement. If you want to have a tentative research question around this statement, you may be looking at why are the numbers of children with obesity increasing? You may be thinking, oh, it's like the number of children with obesity are increasing. Why are the numbers increasing? You may also consider, why do we have increasing number of obese children? But the statement that made you or that prompted you to have that question is because there is absence of regular exercise and so on. However, the question will come before the statement. But when somebody made a statement, then you can create questions out of it. Now, let's assume another statement. Why are patients' BP out of control in my clinic or the patient that I'm seeing? You may now be asking, maybe the statement is that more people are having increased blood pressure. Then you may now ask yourself, why are the number of people with increased blood pressure, increasing blood pressure, why are the number increasing, and so on. We are going to have like a practical example. Now, what are the characteristics of a good research questions? If you know the characteristics, it will also help you it will guide you in knowing exactly how to go about for forming your own research questions. Now, it must be feasible. You can use the acronym FINER, FINER. Now, it must be feasible. with the resources that you have, you should be able to achieve what you have planned. The time should be enough. Does it have enough statistical power? This has to do with the number of people you are studying. Do I even have expertise in doing this? Let's assume that I don't know anything about pathogenomics, and I'm thinking of, I want to look at the differences in my lab. I want to collect blood sample of patient with mpox, and I want to take it to my lab and test the class. It's been established that we have class 1A, 1B, we have class 2, maybe A and B as well, and you want to know, is there class C? And I want to collect blood sample. In my lab, or maybe all I could do is just pack cell volume, or I can count number of malaria parasites in the blood sample. And I want to think of, I don't have the expertise in the first place. So it is not feasible for me to do that. Somebody else may be able to do that. Now, is the research question of interest? Is it interesting? Interesting to the subjects and also to the investigator. As an investigator, is this subject interesting to me? Is it of interest to me? If it's not, if it is, how about to the subjects? If you tell people, oh, I want to conduct a study and what I would like to know is this, and people are not really interested in it at all, then it's not interesting. If it is also interesting to you only and it's never interesting to any other person, I think you should be cautious. Now, let's talk about the novelty. Is there anything innovative? Is it even interesting? Is it of interest to funders? If they hear of what you want to do, would they be willing to fund your study? If it is of interest to only you again and not to any other person, then you need to be cautious. Maybe you are not communicating what you want to do in a clear way. Now, it must be of good ethical standard. You can't just do things that are going to compromise ethical values. You need to safeguard the interest of the participants. Institutional review board, they must also approve whatever you are planning to do, and it must be relevant. You may think of something feasible, fine, it's interesting. Your funder may want to, some funder may be interested in it, but when it comes to relevance, it is not of any relevance. Then you need to drop it. And mind you, you can't decide without a ground in the literature, without reading the literature, without going through what is in the literature. You cannot be grounded. You may not be able to answer any of these questions. You may not be able to say that, oh, these characteristics has been fulfilled in my study or not, until you read what is in the literature. So it goes back to reading. I've mentioned two things repeatedly in the course of this meeting or this seminar. One, you need to consult someone. Mentors are very important. I've mentioned it directly and indirectly. Two, you need to consult your literature. Apart from consulting people, literatures are very important. You need to see what people have done. Now, a strong research idea should pass the so what. When you want to do something, and then at the end of the people are saying, and so what? Having done it, what are you adding? What are you contributing? What is the benefit of answering your questions? If you have a question and people are asking that, then what's the benefit of answering the question? Then you should also be cautious. That doesn't mean you can't continue. You may need to reframe your question. You may need to read more literature, find out what people are doing. Now, what is the purpose of your research? If you are not able to answer that question as well, then you may need to reconsider your research question or research topic. Now, why did you choose the approach that you have chosen? Why have you chosen to do it the same way? Probably what you are trying to test. There are samples in the lab that you can analyze. There are questions that the questions have been answered. You can go to secondary data repository, like the demographic health survey, they have the data online, or maybe IBS, maybe NAS, maybe MICS, multiple indicator quarters survey. If those questions have been asked in the past by someone and the data have been collected, or you got some secondary data primarily collected for something else, but they can answer your question, then you don't need to go to the field and start spending time going to maybe different states in the country or going to different countries in the region and start collecting data that has been collected already, except if the data that is existing could not answer your question. Now, consider anticipated results and other alternatives. How the proposed studies will move your field, how will it move it forward? If you have a question that you want to answer, and at the end of the day, the question will not contribute anything to your proposal, to your field of studies, then you just think of answering other questions or think of doing other things with your time. Research questions lead to hypotheses. And in a very simple way, I would define hypothesis as statements that the statement that you have not been able to validate, you've not been able to answer explicitly. Questions that are yet to be answered. They are not clear enough. They are like things that you still want to make inquiries on. Objective can be action-based or action points that you want to achieve in study. When you look at, oh, maybe I can formulate an hypothesis and so on. So we need to see all this. Some colleagues are putting some questions on the chat box. This is very important. We'll talk about it soon. Thank you so much. Now, let's talk about SMART research questions. SMART as acronym. Let's look at all the items or the words in SMART and use it to explain our research questions further so that we can gain clearer understanding. When you mention SMART, the S means specific. The question should be clear and focus on a particular aspect of a topic. You can't be too broad. Once you are too broad, you become vague. Now, let's look at an example. A research question says, what is the impact of healthcare on communities? Is that question specific? What is the impact of healthcare on communities? If you think that it is specific, you can type yes in the chat box. If you think that it is not specific, you can type no. I just want to see 1 or 2 yeses or no. What is the impact? Thank you so much. I've seen 2. Thank you. Thank you. What is the impact of... Now, somebody felt it is smart. Then you may have reasons why you felt it's smart. What is the impact of healthcare on communities? Majority, I've seen several no's. Thank you so much. Most of the responses I've seen on the chat box, they are no, 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 no. So, well, let's do the way it is done in the parliament. The no's have it. It's usually yes that have it anyways. That's on the lighter notes. So what is the impact of healthcare on communities? I want to agree with many of our colleagues that said it is not specific. Now, why is it not specific? Now, which of the communities? What aspect of healthcare are we talking about? Now, I've added 2 answers, but I want to ask, can somebody unmute and tell us, why do you think this? You can use the hand raise icon so that I will call you to answer. If you want to answer, you can use the hand raise icon. Why do you think this is not specific? Now, David Agala, I don't know the title, but let me just mention your name as it is on the participants
Okay, thank
list.
you very much. Thank you very much, Prof. So for me, I'm looking at this topic as if we want to measure the impact of healthcare has several aspects. So to make the question more specific, we might want to begin to say, okay, a particular intervention in healthcare, I think a particular aspect of healthcare. So that will be more measurable. Can also, okay, this by implementing A and B, this, it has been able to advance this. But if we are saying broadly healthcare, I don't think it is something that is measurable.
Okay, thank you so much. Now, let me allow Chidinma Amoze to also contribute to the discussion before we move on.
Okay, thank you very much, sir. So in addition to what you have also stated, the very first one also didn't tell us specifically where these communities were located. So I think that's another thing that is making it not specific. Thank you.
Thank you so much. Yeah, I won't be able to take further. Others can, if your hand is up, don't worry, keep it up. I will ask another question very soon. Thank you so much, David. Thank you so much, Chidinma. I appreciate that. You have actually hit the nail on the head. Now, if I want to rephrase this research question, the question is, what is the impact of healthcare on communities? David said the type of healthcare was not mentioned. And Abose was telling us that the communities, where am I carrying out this study? Where do I want to answer this question? Now, I can rephrase it to what is the impact of maternal healthcare access? It's not just maternal healthcare, but maternal healthcare access on infant mortality rates in Lagos State, in Ekiti State, in a particular location, maybe a particular town. a particular community, a particular hospital. Yeah. So what is, somebody also said that the population was not mentioned earlier. Thank you, Abel, for contributing that. So for your research question to be specific, let's try to put our questions as you are listening. If you have something in mind, you can put the question down and then use what you are hearing now and contributions from colleagues to try and modify what you have in mind. So thank you. Now, let's move on. SMART research questions, it must be measurable. Now, I've added another example. The example is your question should be quantifiable so you can measure or assess progress, outcomes, or changes. Yeah, colleagues, kindly mute yourself if you are unmuted, or the co-moderator can mute them. So your questions should be quantifiable so you can measure or assess progress, outcome, or changes. Now, let's give an example. Instead of how does the government improve healthcare? That is vague. Government of where? What kind of healthcare? And so on. So many questions. Now, I want someone, let me see if any of my colleagues have their hands still up. Okay, nobody's hand is up. If you want to contribute to that, you can also use your hand raise icon. Now, how does the government improve healthcare? To me, it's too vague. You might ask, how has the number of patients receiving free maternal health services in Lagos, in Ondo State, in Ekiti State, in Yobe State, how has it increased from 2020 to 2024? That is what makes it measurable. You must be able to put the place, the time, the where, and so on. All these are very important in crafting SMART research questions. Now, let's look at A. A means achievable. Always ensure that your research question can be realistically answered within the available time, resources, and scope. Now, let's look at... Sorry, can you mute yourself? Okay, thank you. Thank you. So, what is the effect of community health worker interventions on immunization rates in rural Ekiti? Now, this can be achievable if community health workers' data on immunization and statistics, if they are accessible, you can achieve this. But if they are not, it will be difficult to achieve this. So that is your study, your research question must be realistically answered within time. Look at the time that you have, look at the resources. If you are maybe a master's student and you have just 6 months or maybe 8 months, 3 months, 4, 5 months to conduct your research, and you want to look at effect of community health workers intervention on immunization rates in Nigeria, and the data is not existing already, you want to go to maybe 6 states or 12 states, maybe 2 states per geopolitical zone, and study all the community health workers that are working in the primary, 3 months is not enough for you to collect your data. So look at your achievability based on the time that is available, the resources that you have, apart from resources, the scope of your study. Now, let's move on because of our time. Let's look at relevance. SMART research question has to be relevant. Research question should be directly related to the topic or the problem that you are investigating, and it should address an important issue on the field. It must address an important issue. For example, how does the introduction of that is a particular health insurance program in Ekiti. So in Ekiti State, Nigeria. So Ekiti is one of the states, one of the 36 states in Nigeria. How does the introduction of the Ulerawa, that's the name of the insurance scheme, how does the introduction of Ulerawa health insurance program affect healthcare accessibility in Ekiti? Is highly relevant to understand health access in the state. Now, Ulerawa is a particular health insurance program. Now, how does it affect healthcare accessibility? This is irrelevant because the program was introduced by the government of the state some few years back. So you may want to look at how has it improved accessibility? Looking at data before the health insurance scheme was introduced, and now what has happened over the time, it is the relevance. The state government, if you do this for them, they may be very happy that, wow, thank you for helping us to assess the relevance of this particular project that we started some few years ago. Now, SMART research questions have to fulfill the time-bound characteristics. You need to ensure the question is focused on a specific time period to avoid being too general. Now, what impact did the renovation of 9? Recently, the government of Ekiti State, they renovated 9 general hospitals. Well, I'm sure somebody will be asking, why am I using Ekiti as an example? Well, the reason is well known to me. Now, what impact did the renovation of 9 general hospitals in Ekiti from January 2023 to August 2024 have on patient satisfaction? This is putting a particular time frame. What impact did the renovation have on patient satisfaction? So time bound, you can't just say what impact did the renovation of 9 general hospitals in Ekiti have on patient satisfaction. Well, somebody might ask, when was this health facility renovated, and so on. We'll be rounding up soon so that we can take a few questions. Now, steps for formulating SMART research questions. We've looked at some steps, but there are other few things that I've not emphasized. One, start with a broad topic. Identify the main issue or theme that you are interested in exploring. Do you want to do a study on healthcare? Is your study on education? You must have a particular theme that you are thinking of, and then you narrow it down. You ensure that you focus on a specific aspect of the topic. Is it access to healthcare? Is it impact on nutrition? Is it environment? Just be focused. Now, ensure clarity and precision. You must specify exactly what you want to know or what you want to measure using clear and precise language. One of my professors said that you need to be able to explain your research questions to someone who does not have research background. Somebody used to say it then in med school days, one of my professors, that even my grandmother in the village must understand what you are saying. So you must say it in a way that people will be able to understand. If you are not able to explain your research question to maybe a school-age child or someone in junior school or SS class, as you say it, you will not be able to formulate. You have not formulated SMART. Sorry, can you mute the song? Okay, let me try to do that. I don't think I can. Okay, fine. Thank you. So determine the feasibility. Make it measurable. We have said that. Consider the time. Consider the time that is available. Is the time enough? And so on. Define a clear period during which the study will take place or when outcome are to be measured. Assess the relevance. Ensure that the question addresses an important and meaningful aspect of the problem or topic. Now, let's look at some few other examples before I take the questions. Now, in terms of specific, let's look at this example. How does the availability of maternal health services in Ekiti affect maternal mortality rates? I've used this. I put the examples together so that we can see it. In terms of measurable, what is the percentage decrease in maternal mortality rates in Ekiti State after the implementation of Ulirawa Health Insurance Program from 2020 to 2024? That is measurable. Achievable. What is the impact of increasing the number of trained community health workers on vaccination coverage? You can't just say, what is the impact of community health workers on vaccination coverage? But trained, you want to specify, you want it to be measurable so that you are only doing it among trained community health workers. Then you may be able to compare to community health workers that are not trained or other cadre of healthcare workers. How does the integration of primary healthcare into rural communities affect child mortality rates in Ekiti State? Probably from 2020 to 2024 to make it more realistic in terms of time. What changes in the number of women receiving prenatal care? What changes were observed in Ekiti or in a particular place from 2020 to 2024? So thank you for listening. I consulted several tools, several online sources for the slides, and also I used some of my lecture notes. So I want to appreciate you for finding time to join this session. So it is time to take a few questions and answer, and then we can give answers to that. So back to you, Chair or the moderator.
Okay, thank you. All right. Thank you very much, sir, for the session. That was full of lots of insights. Okay, so we have a couple of questions already in the chat box. Mr. Kelvin will take your question. Kindly exercise some patience. Okay, so the first question is if hold on please. It's two in one. So it says if a previous research was conducted on an interesting subject matter or a topical area in a location, say Ondo State, Nigeria, for instance, can I conduct my investigation or research in another location or setting? That's the first question. And then the second question seems
Sorry,
similar.
can we take it one after the other?
Okay, that's fine.
Yeah, thank you so much. Now, if a study has been conducted in a particular location, for instance, if I've carried out a study in Nasarawa State, probably Lafia town, and someone is now trying to carry out that same study in almost about 45 kilometers apart, somebody is trying to carry out the same study. Now, the population, the question you need to ask yourself is that the population of the people in Lafia, is it different from where you want to carry out your study? Is it different from where you... Now, if I want to look at the PCV of an average man in Lagos, and somebody has done that study in Oyo State to Lagos is about 120 kilometers. The human beings in Lagos, they are not different from the humans that are in Oyo State. So that particular question, location-wise, you don't need to, it's not a researchable topics anymore. Someone has told you what you have, your question has been answered already. You don't need to. Now, let's assume that a particular location, let me use the Federal Capital Territory, for instance. Now, if a study has been done in central area, as an example, and people that are living in central area, they are high-profile people, they are people that are working with the government, people that are working in offices, and you now want to compare them to people that are residing in Aso Village. Aso Village is just a few kilometers away from the central area. You can't do that because there are some circumstances or conditions that the people in Aso Village that they are exposed to, that those in the central area are not exposed to. So despite the location, despite the proximity, it is still a researchable topic in that particular location because of the exposure. But the same population, no difference in exposure, no difference in physiology, and you need to be cautious. You may need to explain that topic to probably someone who has more research knowledge than you do. Thank you. Back to you, moderator.
Okay, sir. Thank you so much. So I think you've partly answered the second question, which seems like the first. It says, in what instances can changing the study location only be sufficient to justify my research question?
Okay, just to add or to emphasize, we mentioned that if the location, based on location, people are exposed or people have different exposures, despite the proximity, you can still go ahead and repeat that study. But in the absence of some exposures different from where the study was previously done, I think it's better you think of or you consider studying something else. Thank you. Back to you, moderator.
All right, sir. Thank you for that response. Okay, so someone is seeking clarification, although I think someone else replied that. Okay, so it's just to see clarity. I think there was an instance where you mentioned that there is a database for questions in research that have been answered. So would like you to add some clarity to this. Is there really...
Okay, thank you, moderator. Yes, when it comes to research database, it's not as if there are some questions stored somewhere, but there are several primary data that has been collected based on some research questions. like the National Demographic Health Survey. The Nigerian Demographic Health Survey is there. It has answered several questions on reproductive health, on use of malaria, insecticide-treated nets, use of contraceptives, and so on. So if you want to carry out a study in Nigeria, you may need to look at that particular research base, because they have the questionnaire, they have the data. You just write a simple email to the custodian of the data, USAID, and so on, maps, and they will release the data to you for use. They are even looking for people to reanalyze and bring out something new from that. I have a colleague who does a lot of secondary data analysis, and he has published almost 100 plus manuscripts from the NDHS, from the Demographic Health Survey alone, and he's still publishing more. Questions that has not been answered through the data, he's still answering them. So it's not only the Demographic Health Survey, we have the Multiple Indicator Cluster Survey, the IBBS, the Tobacco Survey, Global Tobacco Youth Survey. There are many of them. You may need to ask specific questions based on your area of research interest. Thank you. Back to you, moderator.
All right, sir. The next question is from Mr. Kelvin. So, Mr. Kelvin, once Dr. Elisomi answers this question, I would permit you to unmute your microphone to ask the subsequent question. So, the first question from him says, must research questions have a question mark? And is project work for NPH a research program?
Okay, I don't understand the second part of the question very well. Now, your research question must have a question mark because it is a question. They are questions, so the question mark must be there for research question. Now, let me tell you the secret. Sometimes we write our objectives and we now go back to write our research questions based on the objective. It should be the other way. Your research question should lead you to the objective. That if this is my research question, what should be my study objective? So for master students, you still need your research questions. For postgraduate or maybe other levels, you need your research question. But the second question, I'm not too clear exactly what you want to ask. Can the moderator read the question again? Sorry, for the second part.
Okay, so he was asking if an MPH program or an MPH research project work is a research program. Is an
Well,
MPH
thank you for the
research
question.
program?
Yeah, I think we have different types of programs in different places. Now, in some institution, you do MPH or Masters in Public Health or Master of Science in Public Health, and you don't even do any research at all. In some institutions, that is allowed. But there are research-based masters whereby you must publish your research work. So most of the institutions where I've worked, it's compulsory that you have research projects done. And I've done masters that I think 1 year that research was not emphasized. Even though students are meant to do some term paper, they are meant to do some research as assignments, but they are not primary research that they go to the field. And when it comes to research, some programs also allow secondary data, the use of secondary data, some don't. So it depends on the program that you are doing. But if you have the option, it's good to do a research-based master's compared to the other that you may not do any research work. Thank you.
Okay, thank you very much. Mr. Kelvin, kindly unmute your microphone and ask your additional question.
Okay, thank you so much for this opportunity. My name is Kevin. I'm from Lagos. Presently I'm doing my master in public health. My question is this: at the end of the semester, we have a project work, which is a research base, but it's not like field research. It could be descriptive or not analytical, but descriptive or observational. So what I'm saying is that can I publish that research, that project work I've done on particular topic?
Okay, thank you. If you have done a master's and you have done a project work, or it is called a research, or it is called thesis, depending on the institutions and what is used, then if you don't publish it, it's like wasted efforts. Yes.
Okay.
All the masters that I've done, there is none of them that, all the projects, all the programs I've done, I've had publications from them. some 2, some 3, at least 1 publication has to come out of your work. So whether it is, even if you are given assignments, maybe you are given a systematic review to do, or you are given some assignments and you can do it systematically, you can approach it as a research, you can get it published. Thank you.
Also, question concerning the question mark, like some of my topics don't have a question mark. Like, for example, effect of vaccine hesitancies among healthcare workers.
Yes, that is a research topic, not a research question. So the question will now be, what is the effect of vaccine hesitancy among healthcare workers in maybe a particular, maybe Lagos University Hospital, or depending on where you want to use. But what you read out is actually a topic. Your topic doesn't have to, your topic should not have a question mark, especially for your project work. However, at the publication stage, you may put a topic that has a question mark at the time of publication. I've seen some topics in literatures that sounds like maybe the author, they are just trying to maybe use it to draw people's attention. Maybe something like, does household healthcare expenditure matters in healthcare utilization? That is a question. It can be the topic of a research work, a publication, but your research article, when you are doing masters or any program, you are learning, and they want you to learn how things should be done properly. But when you know how to do it well without making mistake, then at that point, not that you compromise standard, you can introduce your own style. You can be like I am, and when you are already like an institution on your own, you can introduce something novel, something new. But at learning stage, you need to learn through the processes, the rigor, and get it done the way it should be done. Now, I will give an example. When I was a medical student, we were taught that when you want to examine your patients, you need to stand at the right side of the patient. When you want to examine your patient's abdomen, you need to go to the lower part of the bed, you need to bend down, you need to look at it from one angle and the other. But now, I've examined patients several times without doing that and without missing anything, because I learned it that way and I've done it over and over again. Now, even merely 1 or 2 touches, I can determine what will take me 2, 3, 4 minutes to get in time past. So when you master the art, you can also introduce your own novel way of getting things done. Thank you. Back to you, moderator.
Okay, thank you very much, Mr. Kelvin, for your questions. Kindly put down your hand. Thank you. Okay, so we'll take this next question before we take Dr. Oyale's question. Okay, so this question is from Awayimbo Ruth, and it says, Sir, what is your take on research using secondary data?
Okay, that's a good question. And I'm thinking that in one of the sessions, probably we'll look at secondary data analysis, writing from it and the like. You know what? When it comes to research, secondary data analysis use saves you the time, saves you the energy, it saves you the resources. Now, if the question you have or the question you want to answer can be answered through secondary data analysis or through already existing data, then you don't need to go to the field to collect data. Let me give an example. I mentioned during the course of the presentation that there was a particular health insurance scheme introduced in one of the states in Nigeria. It was introduced a few years ago, and I'm sure that you can't have any data online if you want to do research about that particular health insurance scheme. No data is available online. But now, if I want to know the use of contraceptives among women of reproductive age in Nigeria, for instance, if my question is, are married women using contraceptives? Let's assume that that is my question. In Nigeria, are married women using contraceptives? I don't think I need to go and design any questionnaire for that. The DHS data can answer that question. And I can even answer it in Nigeria compared to other country, compared to other region, where all the areas, about 19 or thereabouts countries, where DHS data has been collected in Africa. I can compare what is the prevalence of the use of contraceptive among currently married women. So secondary data analysis is allowed. However, if you are doing a program in an academic institutions, Different institutions have their rules. They have their own way. They have their own. If they don't want you to use the current data analysis, it's not because it's not allowed in research. It's because the institutions does not permit the use of secondary data analysis for student projects. They want you to collect primary data and learn, because collecting primary data, you're likely to learn more. The process of data collection itself is worth learning about. So try to stick to the rules of your institution. But if you want to just write and publish, then if your questions have been answered through a particular data collected by some other entities, make use of those questions or those data sets, analyze, answer your questions, and get your paper published. Thank you.
Okay, thank you very much, sir. Dr. Oyaleova.
Okay, thank you very much, Professor Ilusoni, my own mentor. It has been a very, very good section, sir. I just want to quickly ask that for the sake of teaching others, is it okay to also add that your research question should be gender sensitive?
Okay, thank you for the question. Now, it depends on what your question is about. So, for instance, if you want to study something that does not really have any gender inclination or thereabouts, you can just go ahead. But if what you want to study has some gender pattern or inclination, or you want to know the difference between, you can even say male. Let me just give a very funny example. Are male doctors performing better in terms of clinical in the clinic compared to female doctors? Maybe. I just want to put an example that I will introduce male and female anyways. I'm not saying males or females are better. It's not for discussion anyways. So you can introduce gender into your questions based on the kind of questions that you want to answer. Thank you.
Okay, thank you very much for your feedback on that. The next question says, which tool can be used to ascertain the level of correctness and sufficiency of your research question?
Okay, thank you for the question. Now, it's a very good question. You can use the SMART mnemonic. However, if you have formulated your research questions and your topic, there are some tools online that you can use depending on the kind of study that you are doing. Even after you have done your study, there are checklists online too that you can use whether everything is complete or not. But for your research question, I would just advise that you use the SMART mnemonic. Is it simple enough? Look at what you have done, the examples you have used. Is it measurable? Is it achievable? Look at the time that you have, the time bound, and is it realistic? So, or you can use the final mnemonic. Is it the feasibility? Is it interesting? Is it novel? Is it, and so on? Ethically, will it be approved? And also, is it realistic? So if you use those two, I'm sure that you should be able to have a research question that is acceptable and that is good enough for you. And the other thing you can do is to, there is nothing you want to do that someone has not probably done in the past. Have a mentor. Discuss with colleagues, someone who probably knows more than you do. Thank you.
Okay. We'll take Mr. or Dr. Damilola or Demono. Please unmute your microphone and ask your question.
All right. Thank you very much, ma'am. Thank you very much. Good morning, sir. Thank you very much for this session. It's been very, very insightful. And sir, I'm Damilola and I'm a final year medical student. So my colleagues and I, we wanted to carry out this research among secondary school students in our vicinity. That's in Ogun State. We are Olabisi Onabanjo University students. So we want to carry out a research that is pertaining to sickle cell anemia. So we want to just carry out this research in relation to outreach that we want to carry out. So that outreach has to do with going to secondary schools, educating them, just spreading awareness majorly about sickle cell disease. So I want to know, is it good enough that we for a research question that we are aiming to publish later on in the future, to have a research question that has that goes thus: the effectiveness of sickle cell disease education on secondary school students, on senior secondary school students in Ogun State, Nigeria. Is that kind of a question? Is it smart enough? That's what I want to know. Is it something that we can progress in? Although we have done some literature reviews, we didn't see much in Nigeria, but then the one we saw is from I think Saudi Arabia. They did something like that, something like an interventional study, because aside from us doing awareness and all of that, we also want to carry out this rapid genotype testing. This kit, there's a kit for getting a genotype, so we want to carry out something like that. So I just want to know, is it a good and a smart research question? Thank you, sir.
Okay, thank you once again for that question. Now, the research topic, what you have read out is more like a research topic, not a question. Now, that topic, if you want to maybe craft out a question from it, or if you want to craft your research question, you may want to look at what is the effect. Rather than the effects, you can put a what, then it becomes a question. Now, I also want to add that if you want to look at the effects, you need to make that particular research question more smart. There is a need for it to be smarter, in the sense that what is the effect of the education on, you must be able to specify the kind of education and also your outcome. To me, I think it can be smarter than what you have mentioned. The outcome also, the outcome is this increase in the uptake of genotype testing. If the outcome you are looking at, you can look at what is the effect of maybe health education or genotype or whatever. You can characterize the health education on the uptake of genotype testing. Now, you can also look at, will health education increase the uptake of genotype testing among secondary school students in Abeokuta, Ogun State, Nigeria? So those are the ways that you can craft your questions. But the initial one you read out was like a topic, and I would like you to be more specific about your outcome. Your outcome may be the uptake, maybe the increase in the number. That means you must have taken the number of people who have done their genotype already, and now you want to compare to how many would have done their genotype at the end of the health education series or period. But if you are just saying effects, the effects you may not be able to measure it until they get married, or probably when they get their testing done, maybe years later. But do something that is time bound, maybe over a 6-month period. You want to look at the uptake. Maybe you give their health education and you leave them about another 3, 4, 5 months. You go back, ask another question. How many of them, what is their understanding? How many of them have done their genotype and so on? Thank you so much for the question. We can also discuss further.
Sir, please.
Okay, go ahead.
Yes, sir, I have something to say. Thank you very much, sir, for answering that. The main intervention that we wanted to carry out is the awareness program, most especially in public school students, among them. And also we want to do it among private school students too. And we are looking at maybe comparison, such something like that. And also, just in the same research question, the effectiveness I was talking about was that the effectiveness of the awareness program, like awareness education, going to those schools, explaining and making them aware of what sickle cell disease is, how to prevent it, the usefulness of knowing one's genotype, all those kind of things. So we are just that is the main intervention that we want to carry out. So and also the screening I was talking about, that one is just something to just if it's not like we want to do it for all of them. It's just if you are willing to do, then it is fine. It's not by force. But our own major intervention in that study was is to carry out an educational kind of awareness talk to all those students. Then we were thinking of taking a survey kind of questionnaire, have that kind of a session first before we talk to them. Then afterwards, we have a post-survey kind of a questionnaire given, and then we take data from them. So that is what the question and the something is all about.
Okay, thank you once again. What I would like to advise is that you can even your questions, if you are doing a pre and post test, the increase in their level of knowledge may be an outcome. It can be, well, that's more like an immediate output of your study. So you may want to measure that. Is an immediate output of your study. But in this kind of study, since the testing is not, of course, you can't make it compulsory for everybody. You can still look at the uptake. Since you can't force them to have the test done, after you have given them your health genotype awareness education, I would like you to qualify that kind of education, genotype awareness education. Then your outcome will now be uptake or increase in the uptake of genotype testing. So it is still fine. You can go ahead and get that done. So without coercing them, then you want to look at how many of them. So that is your, now in that particular study, you know that it's not only your education that is making them to take the test. If the test is there and it's expensive, they may still not get it done. If the test is there and it's not available to, if they have the test in the hospital, but it's not available in their school. So you need to look at all these variables before you actually decide on what you want to use at your elastic for the analysis. So thank you. Back to you, moderator.
All right, thank you so much. Dr. Adana, over.
All right, thank you very much for the wonderful presentation. It was very insightful. And I wanted to ask about, you had mentioned about a research question whereby you might not be able to, or you're not qualified or equipped to carry out that particular research. So is it possible to, instead of putting it aside altogether, maybe collaborating with someone who is willing to work with you on the project and doing it together? That's okay. Is it possible?
Yes, thank you so much. That's a good question. It is. You can collaborate with more people. Maybe someone that has a pathogen genomics expertise and so on. So you can collaborate and still get the fact that to you, based on what is available, you are asking you are using your final and smart mnemonics to answer your question based on what is available to you at that point in time. But by the time you think that, with the time it may not be feasible, you can do a part of it and others can continue. If it is financial resources that is not available, someone with funding can support you. If it is the expertise, someone with the expertise can join your study. So having collaboration or collaborating with others, I think it's actually a right direction. Thank you.
Thank you very much, sir.
You're welcome.
Okay. Dr. Kazim, please ask your question.
Thank you very much, Prof. Sir, for this very enlightening presentation as usual. There is this part I want to clarify: relationship between research questions, study objectives, and in extension, the null hypothesis. Can we say that the research question is a question form of the objective? For example, now, in the study by the medical students in OU Shagamu, if we say that maybe one of their objectives is to determine the uptake of maybe sickle cell disease testing among several students in Shagamu, can we then say that the research question would be, what is the level of uptake of sickle cell students? I've seen the research where the advisor sent back the student that is just trying to make the question to be a form of objective. So I want to ask, can we say that the research question is a question form of the study objective? Thank you, sir.
Okay, thank you for the question. There are some things that needs to be consistent in your study. The title, the research questions, the study objectives, and if you want to add hypothesis, Everything must, you know what, by the time you have one, you should be able to guess what the other is. If I have your research objective, from it, I should be able to decipher what the research questions are, and I should be able to guess what your topics is likely to be, what's the research topic. So the fact that someone is saying that, oh, you are just changing, that's actually how it is in the real sense. So the research questions, the study objectives, the title, the hypothesis, they are more like exchanging words. And you can't have a research question, for instance, if the research question is what is the level of uptake of genotype testing among secondary school students in government grammar school, Abeokuta, for instance. Then the title of the research is almost known, uptake of genotype testing in Abeokuta, and so on. So if you don't if your supervisor wants things to be done differently, I think you may seek further clarification, because having them not too far from each other is the right thing to do. They must be able to explain each other. Your hypothesis should come from your question or from your objective. So but maybe there are some specific things that the supervisor wants. Maybe the way they were changed or the way they were written does not really bring out the main idea that is of interest to the supervisor. Thank you.
All right, sir. So I think there was a last question before I had internet disruption. Someone asked the question about the use of cargo. About the
Okay.
use of cargo. Yeah, I think maybe you
Now,
can provide some clarity.
yeah, Kaggle is more like an online repository for people who do a lot of data science, people drop practice data and other things there. I would like to advise that if you want to do your research to publish, maybe you should use other databases. I have actually not also used it for any research in the past. So I would advise that it's better to use other databases for your research. People that does a machine learning and data science, they make use of it a lot. So I will advise, I have not used it in the past, but I've used global tobacco control data sets, NDHS, multiple indicator cluster survey, and a lot of other survey. However, most of these are mostly like health related research areas. So in other fields, there may be other databases that I am also not familiar with. So the fact that I've not or I've never used it doesn't mean that it doesn't exist and it's not useful. So thank you.
All right, sir. Thank you, and thank you. I believe we have taken all the questions in the chat box. The session has been very participatory, I must say, and I believe, just like I learned, other participants on this meeting today learned a lot about how to formulate smart research questions, making it feasible, interesting, novel, realistic, time bound, and the rest. So, please, colleagues, as we go this week before our next meeting, please let's refine and review and rephrase our research questions. It is not enough to attend this meeting, but we hope that we apply the knowledge that we gain from this meeting and subsequent ones to improve on our research capacity. And as we learn, it will be important that we distill the knowledge to others. Knowledge shared provides the opportunity for improvement from time to time. Okay? So, to everyone who stayed on the call till the end, to everyone who has, in one way or the other, participated in today's session, to anyone who has consistently attended our weekly webinar sessions, to people who are joining today for the first time, and others in other categories, we say thank you. Thank you so much for joining us, even in this knowledge sharing session. We hope you've been able to gain a lot and you'll be able to apply the knowledge gained. Okay, again, this webinar has been organized by Plus-Circle Community Health Advancement Organization, a non-government organization committed to advancing school health, community health, and capacity building for research. So if you have any question, kindly communicate with us via email or WhatsApp. We'll be glad to attend to all your questions. And if you have any clarification or need support, or you want to make some additional suggestions, please feel free to reach out. We would be glad to take your feedback. Okay, so I would like to bring this meeting to a close, but please, next week, Saturday, 8 a.m. GMT plus one, that's Nigerian time. We look forward to having you again on a meeting similar to this, where we unravel and explore insights to improve our competence in delivering good quality research that answer day-to-day life questions, solve problems in our communities and in the global space, and are publishable. We want to keep disseminating our research findings. Okay, so with this, we say thank you once again. Thank you very much to our speaker, and we hope you have a restful weekend. Thank you and goodbye. Bye.